Hello, my name is Riddell Paris. Today we're going to be doing a comprehensive head-to-toe assessment on a 31-year-old male who is complaining of a headache that began 2 hours prior to arrival. Exertion provokes the pain while rest provides some relief. The patient rates the pain a 3 out of 10 on a 0 to 10 pain scale and describes the pain as a pressure with sometimes sharp pain. The pain starts in the right temple and radiates to the forehead, and the patient believes that sinus issues may be to blame for the headache. The patient has a family history of cardiac disease and diabetes. The U.S.-born natural citizen with a Cherokee heritage. The patient has a spiritual affiliation of Baptist due to his religion. Risk factors for the patient include alcohol use 1 to 2 times weekly and smokeless tobacco 5 times a week. The patient is fully independent on activities of daily living and reports a positive self-esteem with a strong self-concept. The patient works a sedentary office job with no occupational hazards and reports exercising 1 to 2 times weekly. The patient reports sleeping 6 to 8 hours uninterrupted during the nighttime. The patient reports that he eats roughly 2,600 calories in a diet a day with no problems with bowel or bladder elimination. The patient reports interpersonal relationships with his wife, son, and father, along with coworkers. He denies any intimate partner violence, and there are no evidence of such. The patient reports meditation and deep breathing exercises as coping and stress management techniques. Next, we will proceed to the physical assessment. Okay, so to begin the assessment, we will check the skin overall, which appears to be warm, dry, with no markings, bruises, inappropriate for ethnicity and color. So starting at the head, you look at the hair, which is evenly dispersed. The scalp appears dry with no lesions. The head is symmetrical along with the eyes. So next we would check the pupils. Looking straight ahead.
Go.
And the pupil appears to react to the light. Alright, so now I'll have you follow my pin. We'll go up and in. Again, down, this way, again, and down. Now I'm going to have you follow the pin in toward your nose. Moving on to the ears and nose, the nostrils appear symmetrical along with the ears with appropriate elasticity. There is no drainage from either side of the ears. So next I'm going to have you hold one side of your nasal passages closed and breathe in through your nose and out on that side. Okay, good. On the other side. Okay, good. There looks to be no congestion or obstruction. Next, I'm going to rub my hands together here, and I want you to tell me when you can no longer hear the sound as I move these away from your head.
I can't hear it.
Okay, good. And on this side?
I can't hear it.
Okay, good. There appears to be no hearing loss. Next, we will look in your mouth, so I'll have you open your mouth for me, please. Mucous membranes appear moist. We'll look at the tonsils that are present and symmetrical. Next, we'll feel the lymph nodes, the neck down from behind the ears down to the throat. No swelling in the lymph nodes. We'll move down to those lymph nodes in the axilla. They're not swollen either.
Go.
Next, assessing the respiratory system, we will listen to swallowing sounds, along with the heart sounds. I'll have you take a big breath in and out. Good. And again. Listen anteriorly and posteriorly. Okay, and again. And again. And again. One last time. Now I will listen to your heart.
Go.
There appears to be equal expansion and chest rise and fall on the lungs and the chest.
Okay.
The apical pulse is clear with a regular rhythm. The next we will feel for the carotid pulse. is regular. Okay, good. Next, we'll assess the peripheral vascular system. We take a look at the nail beds that appear pink in color with a capillary refill of less than 2 seconds. Next, I'm going to have you hold your arms straight out in front and apply pressure to mine, trying to lower my arms. Okay, good. Okay, now I'm going to have you squeeze my hands, check for strength and grips bilaterally that are equal and strong. Okay, great. I'm going to have you go ahead and lay back and listen to your bowel sounds. I'm going to get ready to get your shirt. Listen in each quadrant. Bowel sounds are present, normal, active in all 4 quadrants. Next, we will check for tenderness. Apply pressure. Let me know if you have any pain. Are you having pain anywhere?
No.
And next we will okay. Alright, you mess it back up. Next, we're going to have you stand. You put your arms straight out in front of you and close your eyes. Try to stay as still as possible. I'll steady you. Okay, good.
Go.
Okay, you can now lower your arms and open your eyes. Next, I'm going to feel your thyroid, and I'm going to have you swallow for me. And again. Okay, great. So that concludes our physical head-to-toe assessment today, with all aspects addressed as far as spirituality and cultural considerations. Our exam appears to be normal with no significant findings for cause of headache. So that concludes our video, and I thank you for your time.